Hi, I'm Dr. John Bennett, and in this video what I would like to talk to you about is using the heart sound recorder as a case management tool. When we do our initial evaluation, we always run a baseline with the scan. And what that baseline will do is give us some very valuable information about the rate, rhythm, and tone of the heart and how the heart is actually functioning. We then take additional tools that we might use in the office, system survey analysis, maybe a 7-day food journal, and most importantly, and I can't emphasize this enough, a nice detailed history. We combined all those things together to start to create those effective strategies or solutions. So again, you're using the HSR as a piece of the pie. It's not a standalone tool. I really encourage you to take it and use it and combine it with the other procedures you might use in your office to come up with the best strategy you can. You know, from running thousands of graphs and literally reviewing hundreds of graphs every week, what has happened over the last several years is I begin to see consistent patterns that appear with certain types of cases. If it's an underlying emotional case, there'll be a certain graph reading that you might see or characteristics of a graph reading. Perhaps if it's a physical trauma or a weakened adrenal system. Another biggie is if we see sugar handling problems or blood glucose issues, what does that actually look like on the graph? And again, I'll combine that with perhaps lab testing in my office or tongue analysis or vestibular posture function, and even the case history. What's going on? What have you been eating? What's different in your diet? See, so you can effectively look at these things and show people, begin to roadmap it for them, what's actually happening with their overall health. Remember, people don't need a superhero. They want to be their own superhero. They need you as a guide to help them along that journey, show them the speed bumps that they might run into, or show them some of the problems that they may encounter. But most importantly, give them the tools that they need, give them the encouragement they need, and then hold them accountable to making those changes in their life. As we look at managing a case, people will ask me, well, how often do you run your graphs in your office? What we do with clients is I explain to them the importance of how the body's physiology takes a period of time to change. Look, if we simply look at a red blood cell will live for 120 days and then go through cell apoptosis. So I tell my clients it's not unrealistic for us to take that initial period of 180 days or 6 months, and that's what I ask them to commit to as we begin to work together to change your physiology. Now in our office, we run follow-up scans every 2 weeks. So every 2 weeks that wellness client's coming back, they're getting those scans run, and we're doing comparisons to actually show the client what types of changes are we seeing in the body. And again, it's not a standalone tool, so I compare that to here's how your posture's changing, here's how your scan's changing, here's what's happening on lab work, here's what we're seeing on the scan. So I encourage you to just start to work with this tool to look for those patterns that you might see. That's what's happened in our office. We've had the ability to see like patterns take place or like patterns happen. So I encourage you to check out some of our other videos where we'll talk to you about some of those particular things that may be happening in your office and how you'll see like characteristics in those scans. Whatever you decide to do with your frequency, I encourage you to future pace that patient and create a care program that allows them to see it's going to take a length of time or a period of time for you to be able to collect data to see what types of changes they're actually making. So until next time, keep running scans and keep changing lives.